Namaste, myself Name-Shivi Saxena, Faculty of Physiotherapy and Diagnostics. Discipline is Medical Laboratory Technology. My topic is dengue fever. What is dengue? Dengue is a viral disease. It is transmitted by the infected bite of female Aedes aegypti mosquito. Men develop disease after 5 to 6 days of being bitten by an infected mosquito. It occurs in two forms, dengue fever and dengue hemorrhagic fever (DHF). Dengue fever is a severe flu-like illness, the influenza, and dengue hemorrhagic fever (DHF) is a more severe form of disease which may cause death. Types of dengue. There are mainly three dengue clinical syndrome: classic dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. Dengue shock syndrome is actually a severe form of DHF. Classification. Classic dengue, acute febrile illness with headache, retroorbital pain, malaria, backbone fever, high fever 5 to 6 days, second fever for 1 to 2 days in 5% fever patient, followed by marked fatigue days to weeks. Classic dengue, 15 to 60% of infection, nausea, vomiting, diarrhea 30%, macular and maculopapular rash 50%, respiratory syndrome, cough, sore throat 30%. Sign and symptoms. High fever, severe frontal headache, pain behind the eyes which worsen with eye movement, muscles and joint pains, loss of sense of taste and appetite, measles like rash over chest and upper limbs, nausea and vomiting. DHF, thrombocytopenia, fever 2 to 7 days, and hemorrhagic manifestation with a positive tourniquet test and hemo concentration or evidence of plasma linkage usually occurs in secondary infection after actively and passively acquired immunity to a different viral serotype. Only 2 to 4% of secondary infections result in severe disease. Mortality is 10 to 20% is if untreated, but decrease to less than 1% if adequately treatment. Plasma linkage may progress to dengue shock syndrome. Sign and symptoms. Symptoms similar to dengue fever, severe continuous stomach pain, skin become pale, cold or clammy, bleeding from nose, mouth and gums, and skin rashes, frequent vomiting with or without blood, sleepiness and restlessness, and patient feel thirsty and mouth become dry. Rapid weak pulse. Transmission cycle of dengue. The virus is inoculated The virus is inoculated into human with the mosquito saliva. The virus localizes and replicates in various target organs, for example, local lymph nodes and the liver. The virus is then released from these tissues and spread through the blood to infect white blood cells and other lymphatic tissues. The virus is then released from these tissues and circulates in the blood. A mosquito ingests blood containing the virus. The virus replicates in the mosquito midgut. The other ovaries, nerve tissue, and fat body. It then escapes into the cavity and later infects the salivary glands. The virus replicates in the salivary glands, and when the mosquito bites another human, the cycle continues. Preventions biological target label uh, larval stage of Aedes in a large water storage container. Larvaceous fish, endotoxin producing bacteria, and copepod crustaceans, mesocyclops, and chemical thermal fogging, methane, and insecticide treatment of water container, space sparing yani thermal fogs, indoor space sparing 2% pyrethrum organophosphorus compound. Social issues. All the goal of disease control is to prevent epidemic transition. If an epidemic does occur, ways to minimize its impact include teaching a medical community how to diagnose and manage dengue and dengue hemophilia fever, so they are better prepared to effectively manage and treat large number of cases. Mortality from DHF will thus be minimized. Implementing an emergency contingency plan to anti the logistically issue of hospitalize large numbers of patients and to outline measures of community-wide vector control activities. Such plan should be prepared with the participation of all parties and agencies involved and should be ready for implementation superior to the emergency of an epidemic, educating and journal public to encourage and enable them to carry out vector control in their home and near home. Thank you.